Hello, I'm Karen Staab from Chile. Let's talk about facial telangiectasia. First of all, we need to know what are we treating. Angiomas and red or violet telangiectasias. Facial telangiectasias differ from leg telangiectasias. Their origin is very different. To understand them, we need to know about rosacea. This disease shows up to 10% of prevalence in white-skinned population, mostly women. Because it is a chronic inflammatory skin disease and affects blood vessels, it can develop telangiectasias. We are speaking about type 1 rosacea that might have telangiectasias. Why do they develop? The pathogenesis is still unknown and has a very important vascular component. Pro-inflammatory mediators develop vasodilation and neoangiogenesis that increases vascular remodeling and chronic skin inflammation. This is a biopsy from a patient suffering type 1 rosacea, and dilated vessels can be seen. This video capillaroscopic image shows the telangiectasia, and this is our target. Facial telangiectasias are inside the dermis of the skin, and we can choose laser and IPL parameters to treat them. Most of facial telangiectasias can be treated with these wavelengths, and we can choose the best pot size depending on the depth of the disease. Many times, we just have to use an IPL device with a spectrum from 500 to 1100 nanometers. For deeper angiomas, we may choose Nd:YAG 1064 nanometers for better and quicker results. This patient has an angioma with telangiectasia. I chose Nd:YAG with a spot of 3 millimeters, 140 joules and 40 milliseconds with 0.5 Hz. After 3 shoots, I changed the parameters to 200 joules with 60 milliseconds. I normally perform 2 to 3 shoots. Every time you must control skin and the filling of the angioma and telangiectasia until they disappear, always watching the skin color and cooling the skin. We use frozen roll and the sapphire of the handpiece for cooling. You may perform many passes until the angioma is gone. In this case, after the angioma was gone, the surrounding telangiectasia should be treated. I used IPL for this treatment, 70 joules and 80 milliseconds, 5 shoots. They didn't disappear, so I used 70 joules with 100 milliseconds, 5 more shoots. Remember, watch the skin and the filling of the telangiectasia. The results after this treatment was very significant and without damaging the skin. This patient had nasal telangiectasias. I chose IPL with 70 joules and 100 milliseconds, 5 shoots, always cooling the skin and watching telangiectasias disappear. After that, we may shoot 5 more times with 70 joules and 60 milliseconds, depending on the depth of the Telangectasias. After this treatment, we've got a very good result. This is patient 1, 5 hours after one treatment with NDYAG and IPL. Patient 2, 2 days after IPL. This is a patient with an angioma 2 weeks after one treatment with NDYAG 1064 nanometers. This is a male patient with rhinophyma and nasal telangiectasias after 4 treatments with IPL. I thank the organization for inviting me to this great event.